City Council will meet, where am I?
A regular meeting.
A regular meeting of the City Council is held in council chambers on Thursday, February 27, 2020 at 7 p.m. Sorry.
And even
for the
the
purpose of transacting in all businesses. Notice this meeting was posted on February 25th, 2020 at 9:52 a.m. This meeting is being taped and is live on SAT. Currently, all absent councils are present. Council President McCarthy presided. I'd also ask everyone now to silence your cell phones or any other device that you have.
I swear I changed it.
I now ask that Councilor Dibble move to dispense with the reading of the previous record. All those in favor, all those opposed? I would ask us to join Councilor Flynn to the Pledge of Allegiance.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Councilor Torrio.
Thank you, Mr. President. I ask for a point of personal privilege, and I move for suspension of the rules to allow the mayor and health department to address the council and the city.
Seeing no objections, Mayor Driscoll. David Greenbaum.
David Greenbaum, our health agent, to join us. We're also joined by our public health nurse, who have been doing yeoman's work over the last several days. Maybe it feels like weeks with regard to this issue. Both Dave and I are heading over to the Salem School Committee, where we have a special meeting to review school activities, but we wanted to take some time to update you as to where things stand with respect to certain parameters and metrics for measuring in Salem, and then go through some of the preparations and planning that we have. And we're happy to come back, given that we have a little bit of a compacted timeline this evening with the two meetings together. So maybe, Dave, you can just give us a quick rundown on current conditions from a health perspective.
Yep. So, as we all know, the COVID-19 virus has impacted Massachusetts. There's currently 108 cases, 6 confirmed, with the remainder presumptive. In Essex County, we have 2 cases, neither of which is in Salem. So, we don't have any presumptive or confirmed cases within the city limits at this time. That's not to say it won't happen. We kind of anticipate that it will at some point. We will have cases here in the community. That's my train of thought.
Well, we're 0-0 right now, so that's
Yes.
good news for us. But
Yes.
as we're all fully expecting it's going to get worse before
Right.
it gets better.
So we've had a couple of incidences where we thought we might have some contacts and some issues. We have some people that are self-identified to us who are self-quarantining out of an abundance of caution. So at this point here in Salem, I think we're in pretty good shape as far as how many cases we have or don't have, and the actions that we're taking in conjunction with the administration and school committee to minimize transmission of the disease.
And maybe we can just take a minute to break down what it means to be pre-presumptive and what it means to be monitoring.
Yep. So presumptive is somebody who has had a test and it has initially come back positive through the state. Confirmed is a test that has been sent to the CDC for confirmation. The CDC at this point in time is the only lab that can confirm a test, but the Commonwealth can do the test and give a presumptive positive. We are monitoring, as I said, I think 2 people in the community.
Currently.
Yeah, and they're contacting us with temperatures, making sure that they are symptom-free if they are, and if they have symptoms, what those symptoms are. I believe one of those patients is going to be tested relatively soon. We don't have a timeline on it, but they will be tested, and we'll find out soon enough whether it's presumptive, negative, or once it's out to the CDC if it's confirmed.
And maybe just one quick overview of, we're asking everyone to follow the CDC guidelines for when you should self-quarantine and what that means in terms of self-quarantining.
Yeah, so if you've traveled to anything that's identified as a risk level 3 country, there's a number of them. I think it's up to 20 or 25. The CDC just last night it was 4, and they've increased it to, I think it's around 20. So yeah, primarily Europe are the new additions. So if you've traveled to one of those countries in the last 14 days, you're asked to self-quarantine for 14 days after you return to the United States. If you think you've been in contact with somebody who may have had contact with the patient, or it was a case in Salem or in another community, we ask that you quarantine for 14 days from the notification of that contact. The Biogen thing in Boston has really skewed the numbers because the majority of our cases are related to that. We haven't had many other cases. I think one in conjunction with the school was for travel, but the others, most of the others in the state are because of the Biogen conference 2 weeks ago. So,
And these are cases of quarantining, not cases of illness.
Right.
So it's just people that are being precautious and making sure that that's a contact or a potential contact of someone who could be ill with the virus. They are doing that 14-day wait period, staying in their home, following. There's a whole guideline on how to quarantine. And when I'm in contact with them, that's what I'll go over with them. They all receive no knowledge, right.
And we have had a number of inquiries from people who have been in close contact with somebody who's been in close contact. It's sort of this ripple effect. And we're encouraging folks is to call the public health department if you're not sure. Folks who are trying to recognize that even though they don't have symptoms, they're really being very judicious, sort of thinking about, should I be quarantining? If you're not sure, you can always call the health department. And we do have a number of folks who have some second or third degree relationship to somebody who was in the room when they were serving food at the Biogen conference. It really is becoming quite the ripple, and so it's always great to ask. We want to make sure we're following the CDC guidelines.
Yes.
Can you just let folks know the best way to contact us, just in case folks are not here, thankfully. We don't want to have large gatherings. If they have questions or if they're not sure about a process or a procedure.
they can always use email through the website, or they can call the health department at 978-741-1800. And either Suzanne or I will field a call and answer the questions to the best of our ability. There's a lot that we don't know at this point, and as we get the information, we'll certainly distribute it out to all the relevant agencies and officials so that they're up to date on what is going on.
So I'm going to run through some of the steps that we've taken in preparation for this, and then obviously there's a big bucket of work going on around schools as well. With respect to existing offices and city department and municipal buildings, we've taken steps to make sure we're doing additional cleaning, disinfecting. We're working in close collaboration with the school department with this electrostatic sort of fogger piece of equipment that we have that allows us to really tackle large-scale areas, any hard surfaces, any high-touch areas where the public may be touching, spending extra attention on those. So daily cleaning has increased. Deep cleaning is also occurring. We are also monitoring what equipment and supplies that we have. That there's been a real run on supplies. It looks like we're in good shape based on both the existing vendor contracts we have, the supplies we have on hand, and what we're expecting to get over the next several weeks. But again, depending on how long things go, we are using a lot more soap. I don't know what people were doing before, but a lot of these things we're running through. So we're really being careful about monitoring how much we have and making sure we're staying on top of that. We're also looking to screen visitors coming into our building. So you'll see signage that the Public Health Department has put up about how to protect yourself, the things that you're all reading and seeing about washing hands. We also want to do some screening, both in municipal buildings and school buildings. If you've been to a level 3 country, if you're experiencing illness, you don't have to come in our building. Here's a number you can contact to try and get the service that you may need, knowing that we have so many members of the public coming in at one time. We don't want a delivery person to trigger an incident in one of our buildings by virtue of the fact of maybe not really forward thinking about his or her presence in the building and what it might mean. So that is something that you'll see going up shortly in terms of signage. We reached out to all of our employees. We've had several department head conference calls to go through some of these recommendations for the CDC on. So they're aware of all of the things that we just talked about around quarantining. If you're feeling ill or sick, we advise all supervisors and employees, we really don't want you here at work. Let's just be better safe than sorry. We have a whole protocol for older adults as well who are in the high-risk category, strongly urging folks to, maybe stay put, certainly avoid large gatherings, and avoid traveling on cruises, or frankly avoid traveling where you're going to see large crowds, and just reducing as much as possible any risk or potential risk to themselves or others. We have suspended all employee travel and have suspended any large gatherings of city events that are being hosted, anything that's non-discretionary in particular, things like the book's favorite events, right? The book swap, open houses at schools, things like that are being canceled. And we're asking, we're really thinking hard about the regular business activities, meetings like this. We do have to still conduct city business. For right now, we've left regular city business in place, meaning those meetings that are tied to a regulatory board, but we are looking at other practices to bring into place, and there's no guarantee they will remain in place. Perhaps the next 2 to 4 weeks is really the critical time frame. What we're learning from public health officials is it's the biggest precautions we can take are over the next 2 to 4 week period of time to flatten that curve. Some of us have seen that diagram talking about where we're at right now. We're still on the way up. We really want to do everything we can to not overwhelm our hospitals, our healthcare officials. So we will be looking at what is the best plan for us in terms of business meetings. We know there are tools and resources for remote participation. Those are being actively explored. Some of those are being tested. So we may have some options as an alternative so we can continue to move forward with some of the meetings and activities that we know need to take place. But we really want to be careful ensuring that not only staff, but also board and commission members, anybody who has an interest in an issue, making sure people still have an ability to be informed. And if we feel like we can't meet some of those standards, we're really going to have to look at suspending or postponing some of those meetings that are important, but nonetheless, this takes precedent. In terms of our overall framework for the work that we're doing, we're looking at our continuity of operations plan, and that's really based on 2 sort of goals. One is continuing to provide essential services, so public safety, public works, the things that we know people rely on and need to have and really cannot be delayed or deferred, and also maintaining health, safety, and of the employees who are performing that. So we have activated our continuity of operations plan meeting working group. They're meeting on a weekly basis, going over, okay, what are the tools that we need to have in place to make sure that we have a continuity of operation, that folks can work from home if we had to close this building for long periods of time, that we still have the ability to get the work done that needs to get done, paying vendors, paying payroll, ensuring that those essential services are maintained. We also have an incident command management system. That would be something we can implement. We do implement that when there are large-scale incidents. We're missing our incident command management system public information officer. So it does, though, provide a way to triage information getting out externally. That's really critical in the event we were to have some incidents that we need to make sure we're communicating. I'd ask, as we think about that, we'd ask for one sort of point of contact for the City Council. I've had some discussions with the Council President. Instead of having all 11 of you, fielding questions to staff and department heads who are also on multiple conference calls, addressing issues with staff and members of this continuity of operations planning effort, that perhaps we direct questions or queries to the City Council President, who can be a point of contact, and we will direct information to him as well so he can get it out. We'll probably direct it to everybody when we have postings, but I think it would be helpful for us not to be fielding 11 queries and helpful to have one coming in. With respect to schools, we're heading over to the school committee for a special meeting. I think folks know we had an early release day at Salem High today. That was really brought on by the overnight news that we had more countries that were level 3. We had a staff member who had been to France, which was not a level 3 country when she came back, is a level 3 country this morning, and we really felt like we wanted the extra time to get additional deep cleaning. We have been doing deep cleaning in many of our schools, so they've been on a schedule, but the phrase that we all are getting to hear a lot more of, out of an abundance of caution, we really felt like it was important to remove folks from that building so we'd have the extra time to clean. It wasn't long before we started having additional, hearing from additional staff and parents and family members with the additional countries. Just more people feeling like they had exposure to someone who may have had, close relationships with either somebody tied to Biogen or somebody tied to a country visit. And we made the decision to close schools for tomorrow as well, so we can go through and really have the time we need to do the deep cleaning and take all of these precautions. The epidemiologists, the public health officials are it's like a scared straight talk that these next 2 to 4 weeks are critical. Anything we can do to maintain that safe social distance is really where we need to be focused on. And so I think tonight we're going to be talking a lot about closure of school for a longer period of time. There have been a number of school districts already near to us, not so near to us, who have closed schools, in some instances for 4 weeks, all the way through school vacation, in some instances for 1 week, and then a whole slew of folks who have done it for 2 weeks. Some of these communities are similar to Salem. They're gateway cities. Some are not. And it is a hardship for us when we close schools We are the largest child care provider in Salem. We are the largest meal provider for youth in our community on a daily basis. So we really need to be focused on those populations and those hardships. And it's a balancing act. On the other hand, this public health and safety threat is very real. And so, I would say to you, we're going to talk about this a little bit later this evening. I think we're leaning towards an extended closure to enable our public health officials to be sure that we're not doing anything that's going to contribute to the growth and spreading of this virus. In addition to schools, so I should say there's also plans going on there for continuity of operations around food services while we're not in the building, delivery of meals, how we work with facilities in terms of deep cleaning and doing the additional work we want to do there. And then just care. Child care is an issue, yet we need to maintain these safe social distances. So this is not like a snow day where we might be able to get the Y or the Boys and Girls Club or one of our great youth services partners to work with us, because in essence we'd be putting the kids back into that same position of being in close contact. So it's super tricky to come up with some alternatives for how to manage schools being out. We are also looking at the most vulnerable students we have. We do have kids who are also providing daily health care for and meeting those health care needs, and kids who are super anxious about changes in routines and schedules. So there's a whole team effort going on in the schools trying to understand how we can do our best if our buildings are going to be closed for an extended period of time to meet these needs. Community-wide, we're also looking at our most vulnerable populations. That includes the elderly and our homeless population. The Community Life Center will be closed tomorrow and throughout the weekend, closed to the public. We will still have staff there available to answer questions, address social work needs, if somebody needs to come in and drop off paperwork, things like that. But we want to avoid large gatherings. So we have exercise classes and things that take place that are wonderful social programs, but they do bring together large gatherings of people that we are a little bit nervous about having in that confined space and not in compliance with the social distance guidelines. We will determine what the plan is for the remainder of the next 2 weeks there, as well as we think through some of these protocols. What are some of the activities that are taking place? We're going to do our best to maintain the openness of spaces in a way that is smart, whether it's the CLC or the library, but recognizing that we want to make sure we're doing all that we can to adhere to these precautions. We've got meetings lined up tomorrow with Public Safety and LifeBridge and any of our other providers who are we're working with on our elderly population. So meals, we still have a Meals on Wheels program that will continue. Congregate meals, we're looking for alternatives to make sure we're getting meals to seniors who come into the CLC for those offerings. And those plans are in the works and moving forward with both vendors and others. Same thing with LifeBridge, who is also having challenges when our schools are closed. Some of their staff are not able to work because they now need to provide childcare for their kids. And so there's a little bit of a totem pole effect that goes with some of these decisions, and we're going to have to work together to understand what their needs are. The last thing I'll say is financing. I do think we're going to see some increases in costs, both in supplies. Supplies have ramped up. Some of the things that we're purchasing on a regular basis, we're seeing a 2/3 increase in those prices of some of the cleaning products and materials. I know the AG is on it, but in the meantime, we just need to have things. So we are moving forward with purchases as necessary. We also will, for sure, have some overtime, unexpected overtime costs that are tied to the additional work that we're doing or potentially contracted and vendor services. Our custodians are really the unsung heroines in all of our buildings every day, but even more so now. But there's only so many hours they can work too. So we are also looking at what are the other alternatives for those costs. And we may have some costs that we are incurring as a result of delivering food or other alternative service plans and models that we're going to have to come up with over the next couple of weeks or longer. Like what we don't know is how long we're talking about. Right now, at least the best experts are telling us the next 2 to 4 weeks is the really critical timeline. And there are some school districts and cities and town halls that have closed for that period of time. Given the number of people who rely on the services that we provide, we're really being thoughtful about that decision going forward. I think I'm going to pause there and certainly have some opportunity for questions, but we really do need to take off in about 5 minutes, and happy to come back or field questions in another format as well.
Councilman Doyle, then Councilor Dominguez.
Thank you, Mayor and Health Department, for all the work. I'm sure it's very stressful, and you're all keeping it together. So we're really comforted by the fact that we have competent staff working on this. So I've been fielding lots of questions, and I wonder if all my colleagues have been experiencing the same, and whether we could work together to provide an FAQ for residents. I think some of the questions that I'm getting a lot is, who do we call if my elderly parent or spouse needs services? And I always tell them, I'm not the doctor, so please call your provider. But obviously, that would be good information to circulate. And another question is, how do we support the folks who are impacted by the pandemic in direct ways? So loss of wages and homes, and whether the city has resources to provide kind of a transitional support, or link or provide them with connection to a state agency or federal agency that can support them. I think Salem Chamber of Commerce issued something this morning or this afternoon that was really helpful for the business community. And then lastly, some of the high-risk populations are in our housing authority properties, and I haven't heard any mention about housing authority. I hope there's a strong partnership and communication going on. I'm seeing you nodding, so yeah. I hope that's really top of your priority list. And then one final question is whether there's a way for folks who can sign up to volunteer to deliver services to those who are either self-isolating because of quarantine, or just being proactive, isolating themselves. So again, going back to the housing authority residents, I think they're definitely high risk, and they rely on social activities to stay healthy and well, and not being able to participate in social events is actually detrimental to their health. So I wonder if there's a way to kind of support in that way, whether through volunteers, or maybe you're already setting up a system for that to take place. Thank you.
I'll pick up on a couple of them and say, if you're getting inquiries from folks, it would be super helpful if you could direct them to us, because there are existing services that we're trying to build off of, or sometimes folks aren't even aware of, that we can put into service for individuals who may not have normally done that. But elderly staff assistants in particular, we have social workers, we have the Are You OK program, and so we'd like to know who they are and can start the touchstone. And we'll set up a repository for where you can put inquiries, so then we can try and work off of that, and either come up with an FAQ, get back to you directly if it's a one-on-one, set of inquiry that maybe others don't have. We are looking at loss of wages for municipal employees. I know the state and federal government are trying to understand, are there pools for folks who might work in the private sector? We're going to try and stay on top of that, and we'll certainly share information. We have a number of our own part-time employees that we're going to do our best to make sure, through no fault of their own, schools are closed, or City Hall might be closed, or those sort of circumstances, that we can do our best to try and make folks whole. That's still something we're looking at, but I think we're striving to try and do that. We had a housing authority meeting yesterday, so we're making a lot of connections there. The executive director has tried to keep folks up to speed and in touch with individuals about what their needs are, and a lot of those individuals have overlapped with our Meals on Wheels programs or other existing social services, but there is a connection there, and in terms of trying to make sure those folks have information and aren't feeling isolated, as much as we can say that when we really don't want folks in large gatherings coming down to the typical things they may have done in a community room or St. Patrick's Day gatherings and things like that. We canceled this morning's St. Patrick's Day gathering and gave folks to-go meals instead. So we're trying to figure out the best way to have alternative plans in place. And we are looking at a volunteer match service. It's a little tricky. Are we going to Corey check folks? Are we just doing the match and sort of connecting people together? We've got CLC staff, investigating how something like that might work right now.
And there is a program that exists called Mass Response. Anybody's heard of the Medical Reserve, or it's often used for medical staff. If we were new vaccinators for some reason, we would reach out to them. But it's also a website. You go to massresponse.org to sign up. And I think most outreach is probably on a regional basis, but if Salem volunteers are needed, that might be another place to go. They send out emails often with people who don't stay home going on. So they send out for that. And for FAQs, there's also been some communication from the Massachusetts Department of Public Health, because I don't think they're alone in getting a lot of those questions. And so the state is hopefully going to be sending out, they said by the end of the week, so that'll be tomorrow. So we're hoping to get some FAQs from them as well that we could send out, and hopefully we'll be able to.
And I would just add that if you are getting inquiries about, somebody's not feeling well or things like that, the first push should be to their primary care physician. And if they really want to, follow up with us, that's fine. We'll certainly field their call and, try and assist them as best we can. Absolutely.
And to be clear, call their primary care physician.
Correct.
We don't want folks
Yes.
going to the ER or going to their
Yes.
primary care physician.
Especially if they're
without-
running a fever or they're showing symptoms of some sort of illness, flu-like or COVID-19 type illness. So.
And they can call us, and there's also the state epidemiology line, which you may have seen it's pushed out a lot. They have a call center as well, so just give them a
We were at a meeting this morning as well, and I think that Mass Department of Public Health is going to stand up a 211 line
Yeah.
for people to call if they have other questions that, they're not getting the answers they're looking for. So once that's done and we're able to push that out, we certainly will.
Councilor Dominguez, then Councilor Dibble, and then Councilor Flynn, and then I'm going to say the mayor's got to get out of here because she has to go, unfortunately, but if we can make these brief. Councilor Dominguez.
Thank you, Mr. President. I have a couple of questions for you. My first question is regarding the same line that Councilor Madore in communications. There is any personnel multi-language in the health department that can help people who have limitation in communicating in English?
We have a Spanish-speaking employee in our department who is translating in Spanish for us.
That's been publicly let the public know that it is there?
We can push that out, certainly. I don't know how widespread it is, but she's been there a couple of years now, and I think she knows, has met a lot of people in the city, in particular landlords and restaurant owners. So, if you have somebody that's Spanish-speaking and they want to call us, they can certainly call us. We do have, like I said, a Spanish-speaking staff member. She's been out sick the last couple of days, but hopefully she'll be back tomorrow or Monday. We'll certainly work with them. There's other staff members throughout the city that we can refer to get translation services.
So is there any way to public that you have that's a personnel in place?
We can certainly push that
so
out.
people don't panic?
Yeah, we can certainly push that out.
Thank you. My second question is, in the worst case scenario that things come, we don't know what's going to happen. It is any idea or how is how do you call the ability to take care of any big amount of people with the virus? What is the capacity that we have as a city to take care? And we had a plan in place in case something happened.
Yeah, so we do have a pandemic plan through the health department for the city. We're also working closely with the hospital and their emergency preparedness folks up there, so that if there is a large influx, they would be the ones who would handle that influx. We would refer everybody to the hospital. I know in Peabody and in Beverly, Leahy Health over there, they have relationships over there as well. So if it was too much of an influx here, they would probably put overflow in those directions. But we do work closely with the hospital and their emergency preparedness folks up there. So, yeah.
Councilor Dibble.
Thank you, Mr. President. Through you, I'd like to thank the mayor for coming here tonight and our health agent and his staff. Earlier, when we had talked, you were not available to come before us, but you rightfully so rearranged your schedule really fast and appeared before us.
I'll give the mayor credit for that.
Both of you.
She was able
I'm
to
thanking both of you.
The school committee pushed back.
So thank you for coming. The request by the good Councilman Madore on the frequently asked questions, I think is much needed. There's a lot of fear being thrown around all over the place, and a lot of it is over the top, and that fear is it's destructive for a lot of people, especially seniors who are, there's a few in Ward 7 that are overwhelmed by that fear, and that fear can overtake a person. So I think we need to get answers, as you were just talking about, get answers out to the public. Councilor Dominguez and I listened to the mayor from Peabody give a phone call out on a blast, and it was A, B, C, D. He just talked about washing, a certain way to wash, and talked about, he didn't compare it to the flu, but he talked about steps to be safe, and I think we need to do that reverse 911, Mayor, with some basic things that we all should know, but a lot of us don't. Washing our hands for 20 seconds, singing happy birthday. Oh, I've sung happy birthday so many times. It's amazing how long 20 seconds is if you're scrubbing your hands. So I'm wondering here tonight, if you can just clarify a little bit, what does self-quarantine mean? And we should publish what that means. You all are in meetings, and you all know what that means, and I know what it means, but what does that mean to the person that's home right now watching this and will be watching this show, this council meeting over the next couple of weeks? And then that should go in the frequently asked questions. Also tonight, can you clarify what the 2 to 4 weeks means? Does that mean after 4 weeks from today that we're kind of out of the doghouse and we're going to be in better shape as time goes on? Let's through the health agent, can we just clarify what that means, the 2 to 4 week period that we keep talking about here tonight?
So I'll try and take them in the order you gave. So
Okay.
just a couple of common sense precautions that everybody can take is frequent hand washing, singing happy birthday for 2 times so that you get that 20 seconds in. Soap and running water is always good. If you can't wash your hands, hand sanitizer is a safe alternative. Cover your coughs and sneezes into your sleeve and your elbow, things like that. Use a tissue. You know, covering up is going to save a lot of problems. The one I can't stress enough is if you are sick, stay home. We don't want people who are showing symptoms of any illness, not just COVID-19, but any illness out in the community, spreading illness around. The problem we have is COVID-19 mimics a lot of the same symptoms as the flu. So we don't know if you have the flu or if you have COVID-19. So if you are sick, the guidance is to stay home. In reference to the 2 to 4 weeks, I think the mayor will probably reiterate that we think that the curve is going to go up, and we hope at that point at 4 weeks we've peaked and we're going to come back down. But there is no guarantee that that'll happen.
And that's why the precautions we can take over this next 2 to 4 week period of time are really critical to avoid putting people in spaces together where the disease can be transmitted and spread. So this is all about trying to avert spreading the disease, or the virus, not so much a concern that somebody has it, as much as it is coming from, we don't want it to be spreading in a way that it's going to overwhelm healthcare professionals.
Yep. So through you, Mr. President, while I have the floor, how soon do you think we can get that frequently asked question list, and how soon can a reverse 911 go out? And can you reiterate your telephone number should people have questions? What is your health department telephone number?
The general line at the health department is 978-741-1800. They can reach any staff member through that number, and they can also reach any staff member through our emails on the website.
And hopefully the state will have the 211 number up within the next 3 to 4 days. I know they're working hard and doing some testing of it. We do have 2 public messages up on the city website. We certainly can do a code red. We're waiting until tomorrow, frankly, because that's when we're going to have a joint discussion with both the school superintendents in the state, and DPH also has a conference call with local officials scheduled in the afternoon. We would love to have some definitive direction out of DPH that we could share with folks, and how that then will obviously work in concert with the actions that were taken locally. So I would expect that to happen tomorrow. And this FAQ should be available anytime, but I don't want to give you the impression that there isn't information available. We've had 2 updates posted sort of on all the things you've mentioned, from hand washing to precautions to actions that the city may be taking to try and address the issues that we're all concerned about.
And on the health department web page on the website, there is a COVID-19 tab. It links to Mass Department of Public Health and CDC, and that gets updated daily. We did have a problem with it last week, so we're checking it daily to make sure that the site is still working, so people can go there and get all the most updated information from DPH and CDC.
I think the other thing I would say to the counselors who are here, it's our opportunity also to try and quell some of that anxiousness. There is so much nonstop news 24/7 about this, to the extent that we can remind people that actions are being taken, and the best thing they can do is avoid large gatherings, maintain that social distance, not put yourself in a position to have this spread to you or to spread it if you have it. And we're going to get through this. I mean, we're starting to see things get back close to getting back to normal in China. We know what this looks like, and assuming worst case scenarios don't present themselves worse than where it already has been, we hopefully in the next 90 days are not still talking about this.
Yeah, I think we're seeing that the curve is the same as what took place in China. So China was a couple of months ahead of us. We're in the thick of it right now, and I think that as we go through the next 2 to 4 weeks to 6 weeks maybe, we're hoping that we will see the peak and the decline start to happen. But again, there's no guarantee that will happen on that same timeline. So.
Council Flynn briefly, only because the mayor has to.
I'll keep it brief.
Thank you.
He's going too, not just me.
Yeah, I know.
I'll keep it. I did have a concern, and I think it's great there's certain services that we have to delay or meetings, but I'm a little concerned about the public safety part of it, because there is services that we cannot lose, obviously. Police, fire, EMS. My fear is that we could be short shifts from people. Obviously, like you said, we have to call in sick, police, fire. If that's a concern. Another concern, if we had to quarantine a shift or a division or a group. I didn't know if you had any plan in place with mutual aid for other cities if they need help, if we need help. And the other thing is assistance with, state of emergency through the governor. If funds are available to try to fill these jobs, so either overtime or helping out other cities, because like you said, there's certain things that we can't go without, obviously, and we need those services. So I just want to know if you had a plan for that briefly. I know.
So we have mutual aid agreements in place with all of our cities, with many of our surrounding communities to account for any kind of public emergency that we may need. And there's existing state laws, whether you had an agreement in place or not, as you may know, where folks come together to lend services as necessary.
Right.
We are not hearing about resources for communities for overtime and things like that. To be honest, we hope that will happen, but that's not going to be our immediate concern. If we need to put on overtime because we have a circumstance where folks can't work, custodians can only do so many hours, public safety personnel, God forbid, we have to quarantine a group, or people who are spending a lot of time in close quarters that you can't avoid in those jobs find themselves not feeling well, we're just going to have to, that's why we have a rainy day account, and we're just going to have to account for it. And hopefully we can get reimbursed, but right now our main focus is continuity of those services. And that also is public services as well. So DPS, we have abilities to work with communities and have already have protocols set up in place if we need a backhoe operator, a heavy machine, another piece of apparatus to come into Salem. Or vice versa. They may need us.
Thank you.
Okay, so we're going to get out of here.
Thank you.
Appreciate the opportunity. We'll try and keep folks posted. If you do have queries, if you could direct them to the council president, and then we'll get them, and happy to field out. And you can always call us. I mean, I would say call Dominic.
And feel free to call my department anytime. I mean, we'll do everything we can to answer any inquiries and questions.
Yeah, we want to be responsive, but I also don't want us to be overwhelmed with 11 questions around the same thing. So to the extent that you can use your own judiciousness about what can wait and go through a system, that would really be helpful to us, especially if we get into a situation where we have more serious incidents to deal with here.
This has been a very fluid process over the last, and we've had many conversations, and I will just reiterate the fact that I think the importance of making all those queries come through me, back to the administration, and back to the powers to be, is when we do have an answer to those questions, it comes from a united person, that it's whoever that person is going to end up being, where, so all the information is disseminated back to the public. It's not willy-nilly coming from all different, I mean, I know that I take the things that have been posted most recently and just post them to the different neighborhood groups to let them know, but just so that that initial discussion comes from the collective team.
Yep.
And I'd say in this day and age with social media, we do try to update our social media accounts as well with any updates and new information. So if people have those and want to use that type of platform, certainly look at Facebook and Twitter. We try to keep those up to date.
And we're going to get through it. Lots of neighbors are looking for ways to help, and the more that you can encourage that, make sure we're lifting people up. I did hear from the PEM today that they're going to be closing to the public indefinitely, so we're going to have less opportunities for public spaces for those gatherings. That's good from a public health perspective, but we need to make sure we're figuring out ways to connect with people. And so bring back the landline. That's what I said. Thanks.
Thank you.
All right. Thank you.
Thank you. Council Turner moves to go back to the regular portion of the meeting. So moved. Public testimony. We have
This one's the minutes.
2 members of the public that wish. What do we have to do?
The meeting?
Let's do public testimony first.
Okay.
First up is Laurie Stephanopoulos.
I don't know if I should be saying.
There you go. Specifically had them put that up there.
But thank you very much for hearing us tonight. After hearing about the virus, I feel like we're taking up your time, but This has been a very serious matter for my business and for my family even. We've had an ex-employee by the name of Thomas Bala, who in 2018 his license was revoked because he constantly went after one of my clients who put a bad review on TripAdvisor about his tour, even though he didn't work for it, and he was slandering me at that time. When we were at the meeting just about that, he slandered me in public as well. And I just said maybe he'll calm down and he'll let it go and all the above. He has not. He has continued to do so. He's gone after even my Salem Saves the Animals, my not-for-profit. Long story short, I paid for his cat. But the not-for-profit is for stray animals and animals in need, and he was supposed to pay me back. He made a big thing about that. I think that hurt me more than my business. But with that being said, he has had people, numerous repeated attacks on social media, and I'm hoping that you'll deny him tonight, and we'll bring the facts in him for the hearing. And I don't want to take up any more of your time because I need to sing happy birthday.
Thank you. Next up is Kimberly, is it? Branch, thank you. Name and address for the record, please.
My name is Kimberly Branch. I live in Worcester, but I work for Lorelei at Crowhaven Corner, so 125 Essex Street.
Thank you.
With lots and lots of past experience with Mr. Aller. I would just like to ask the council to deny his license.
Thank you. No more public testimony. Councilor Riccardi.
Thank you, Mr. President. I move to go to page 12 of the agenda.
Councilor Riccardi moves to take out of order on page 12. Look at that, they all got numbers on them. Communications from city officials.
Once it happens. We have an order. Do we want to start on okay. Communications from the city solicitor. Ordered pursuant to section 37 of the rules and orders of the city council hereby authorizes by majority vote the scheduling of a joint meeting at the city council and the Park and Recreation Commission on March 24th, 2020 at 6 p.m. at the Jean Levesque Community Life Center, 401 Bridge Street, Salem, relative to land in dispute at 20 Franklin Street.
Councilor Riccardi.
Thank you, Mr. President. I move for adoption.
Councilor Riccardi moves for adoption on discussion.
Thank you, Mr. President. We just learned that the state of affairs that we're currently in, everything is kind of up in the air right now. We do need to have this public hearing. It's in the window that was just discussed, the 2 to 4 weeks. I think it makes sense to continue the scheduling of the meeting, because once the meeting is scheduled, the agenda can be posted, the information can be provided, so we can at least get that out into the public. Obviously, there's a chance that the meeting could be canceled or rescheduled or postponed, but this will at least get the meeting ball rolling.
Thank you. And for everyone's clarification, I had numerous discussions today relative to this matter, and I think that scheduling it is okay, but then I think in the next couple of days, it's going to be relative to whether or not the CLC can actually live stream a meeting through SATV, and also whether or not the city at some point can, whatever other services are provided to allow people to view the meeting, whether it's through live streaming or whatnot, and also then participate in the public comment period. It's a very, I mean, as we've all just heard, it's a very fluid discussion. It's happening rapidly. Things change. I'm sure things have changed by the amount of time we've been sitting in this room. I mean, it changed from me driving in early today to have these discussions that the NCAA basketball tournament had just been postponed, as opposed to it was going to be played in front of arenas with no people in it. So, I mean, things are changing rapidly. So, but I think that Councilor Riccardi is correct in the sense that we don't know what's going to happen in 2 weeks' time, but if we can get the ducks lined up to make this happen, and if it's actually legal, as you know, we're trying to work through the Solicitors Association about live streaming and whatnot. So I think that at this point I would I would encourage the councilors to allow this to happen, but it's at the same time, it's going to be one of those things that early next week we'll be making some decisions whether or not this actually can happen. So Any further discussion? Council Flynn.
Thank you, Mr. President. I understand your point and what you're saying with this, but after listening to what the mayor said in the health department, I honestly think we should hold off for that 2 to 4 week window. I think it would make sense. This is an ongoing issue. It's been going on a long time. I really think with schools closing and possibility, I think we should hold off on this till next month's agenda. Just my personal opinion.
Yep, no, that's fair.
Thank
I mean, as I said, I don't make the rules. We as a body collectively decide. So.
I understand.
Any further discussion? Councilor Dibble.
Thank you, Mr. President. I have to echo the comments of the good Councilor Flynn here. If we can't set it to a date certain tonight for something outside that 2 to 4 weeks, so 4 weeks from now, some date in April, because we don't know our availability, and we should just simply hold off until our next meeting and set a date that works 4 weeks from now. So the public can come to this meeting and they'll know the date. Instead of us switching the date at the last minute to another date, the public that might want to come and speak and learn details about this, they might not be able to track it as well as just having a date certain. So I'd like to set this date at our next meeting. Thank you, Mr. President.
Councilor Riccardi.
Thank you, Mr. President. There is a high likelihood that this meeting will be rescheduled or canceled, but I do want to point out that the developers for this property also have a meeting scheduled for next week that has not been canceled yet, and they are moving forward whether we have our meeting or not. So I'd like to be able to answer some questions that the public will have because of that meeting, and without, I guess, getting the meeting ball rolling, we can't do that. So again, there is a high likelihood that this meeting will be canceled or rescheduled, but that's the world we're in right now. Basically, there's a high likelihood that every meeting or event or conference will be rescheduled or canceled. So again, just hoping to get the ball rolling on this. Thank you.
Thank you. Any further discussion? Seeing none, Councilor Riccardi's motion for adoption. All those in favor? All those opposed? The matter carries. Further communication from the city officials, I'm sorry.
We have an order from the city solicitor, communication regarding an order that the city of Salem is recipient of federal and state funds to undertake a Safe Routes to School project to improve pedestrian vehicle safety in the neighborhood of the Bates School. If you want me to, for including the reconstruction.
Waive the reading. Someone, thank you, Councilor Turrio. Councilor Riccardi.
Thank you, Mr. President. I move for adoption by roll call vote.
Councilor Riccardi moves for adoption by roll call vote. On the discussion, Councilor Riccardi.
Thank you, Mr. President. This Safe Routes to School project for the Bates School is an exciting project that the neighborhood and the neighbors and the parents of those that go to Bates School and walk their kids to school are very excited about. There has been multiple design review meetings. It's a MassDOT project, so it has been going on for a few years. It's also fully funded by MassDOT. I believe the total project is $515,000 that we're receiving from state and federal funds. The piece that the city has to take care of are the easements that are required along the project, which is basically improving the pedestrian quality for students walking to school to make it safer for them. So there are 8 properties that are affected that we need this easement from. It ranges from 1 foot to, I think, 26 feet. We also need temporary easements for the construction period because they're going to be doing sidewalk repair and construction right in front of their house. So they need to have a spot to put their location, and there's a minor bit of budget involved in this as well. Like I did just mention, it's state and federally funded for the whole project, but the cost of the easements that we are providing a fee to these property owners for the easement that we're requesting is the $14,880, so we need the approval of that as well. We ordered and had each property appraised, and then we had or the easement appraised, and then we had a review on the appraisal to make sure that we were giving a fair and reasonable value. And if there are any questions, I guess I'll leave it at that.
Thank you. Councilor Dibble.
Thank you, Mr. President. I'd like to thank the good Ward 6 counselor for her reaching out to me. I think she reached out to the entire council on this. And with a lot of information. And the last bit of information I got a couple hours before this meeting from the Ward 6 council was phenomenal. It just outlined exactly what this project was and how it affects the neighborhood. And I reflect back to about 1987 or 88 or so when we talked about making very similar changes to the intersection that we all know we're talking about on Liberty Hill Ave. That now I'm looking at a plan saying we should have built this 3 decades ago. So I applaud the Ward 6 councilors for bringing it forward and the mayor for finally bringing this forward as well. It's been decades, long overdue. I'd like to vote to support this tonight, but I'm hesitant a little bit because we're talking about taking people's land. And the Ward 6 councilor confirmed with me that it's a friendly taking, that all of the abutters that are being affected by this are in support of this. So for the record, if she could just state that that's true, I'll be voting yes for this, okay? So with that, I have no further questions. If the Ward 6 council could just confirm that.
I would ask that the city solicitor confirm that. Is that correct?
Yes, so we have sent out the statutory notices and given every property owner 30 days to review the just compensation. There was one property owner out of the 8 that we are still working with through his attorney. We believe that once the information that I shared with her yesterday is transmitted to him, that he will be satisfied with the compensation and the work that's to be done. The problem that has come up with this particular case is that the federal regulations require us to get those temporary easements for 3 years. And that is designed to give enough time if there's a delay, weather or whatever it might be. This particular project, once the bid goes out, which they're hoping to do March 28th, once a contractor is selected, they will only have no more than 10 months to do the project, and not anticipating working in front of anybody's particular home for more than a few weeks at a time. So we were able to communicate that, and Mass DOT has given us the flexibility with respect to this homeowner going forward. So I feel comfortable in the council voting tonight on this order, and my resolving that one issue that we have remaining within the next couple of days.
Councilor Dibble.
Thank you, Mr. President. So it's safe to say that this is a friendly taking, that pretty much everybody is in support of this. The one last person probably will be in support of this and working on it now. But as I just heard, I may have just read the documents that I've read all day today. This is a temporary taking, that we're not taking these permanently?
There are both permanent and temporary easements.
Okay.
So the temporary easements are in the couple thousand square feet. The permanent easements are 52 square feet. And they're mostly fence lines and curbing and things like that.
Okay, barring any further discussion on this, I'll be voting in support of this. Thank you, Mr. President.
You're welcome. Thank you. Any further discussion? I want to thank the city solicitor for staying to answer those questions tonight. Seeing no further discussion, Madam City Clerk, will you please call, Councilor Riccardi, we all set? Seeing no further discussion, Madam City Clerk, will you please call the roll?
Councilor Dibble?
Yes.
Councilor Dominguez?
Yes.
Councilor Flynn?
Yes.
Councilor Hapworth?
Yes.
Councilor Madore?
Yes.
Councilor Morcillo?
Yes.
Councilor Presnewski?
Yes.
Councilor Riccardi?
Yes.
Councilor Sargent?
Yes.
Councilor Torrio?
Yes.
And Councilor McCarthy?
Yes. On the matter of the adoption of the order of taking land on certain parcels of land on Liberty Hill Avenue, Appleton Street, and Nursery Street for the project to involve the street and sidewalks leading to the Bates School, we have 11 members voting, 11 in the affirmative, none in the negative. The matter carries. Do we need immediate reconsideration on this one?
Yeah, that would be helpful.
Councilor Riccardi, could you ask for immediate reconsideration?
I move for immediate reconsideration in hopes that it does not prevail.
Councilor Riccardi asks for immediate reconsideration in hopes it does not prevail. All those in favor? All those opposed? Opposed. Thank you. So we'll make a motion to go back. Councilor Torrio moves to go back to the regular portion of the meeting. After,
Three.
We'll have to do 3 first. Hearings.
We have a continuation from the last meeting regarding a hearing from National Grid and Verizon to install one jointly owned pole on Orange Street.
Withdrawn by applicant. Appointments and reappointments. And
We have
thank you for staying.
It's very informative.
Thank you. Appointments and reappointments.
Held from the last meeting, the mayor's appointment of Kristen Masick to the Council on Aging Board with a term to expire February 27th, 2023.
Council Turiel for me, thank you.
Thank you, Mr. President. I move for confirmation by roll call vote.
Council Turiel moves for confirmation by roll call vote. Under discussion, Council Turiel.
Thank you, Mr. President. Ms. Masick is a longtime volunteer here in Salem and a licensed social worker and a very, very good choice to serve on this important committee, and I'm glad she's stepping up for it.
I wholeheartedly agree. Anyone else? Seeing none, Madam City Clerk, will you please call the roll?
Councilor Dibble?
Yes.
Councilor Dominguez?
Yes.
Councilor Flynn?
Yes.
Councilor Hapworth?
Yes.
Councilor Madore?
Yes.
Councilor Marcillo?
Yes.
Councilor Presnewski?
Yes.
Councilor Riccardi?
Yes.
Councilor Sargent?
Yes.
Councilor Turia?
Yes.
And Councilor McCarthy.
Yes. Thank you. On the matter of the appointment of, mayor's appointment of Kristen Masick to the Council on Aging Board, we have 11 members voting, 11 in the affirmative, none in the negative. The matter carries. Council Turiel.
Thank you, Mr. President. I move for suspension of rules to allow Ms. Masick to address City Council should she choose.
Council Turiel moves for suspension of rules. Seeing no objection.
Thank you very much. When I moved here 20 years ago, I never expected to set up roots and to be part of this community this way I have. In fact, I actually got a 5-year adjustable rate mortgage when I moved here. So now it's 20 years later in July 1st, and I'm just pleased and honored to be able to serve the city of Salem as well as its most deserving residents. So thank you.
Thank you. Further appointments and reappointments.
We have the mayor's appointment of Felipe Zamberlini to the Affordable Housing Trust Fund Board with a term to expire March 12th, 2011. No, 2011, I'm sorry. Hold on, 2021.
We'll get there.
We'll get there.
I'm very
Council Turiel.
Thank you, Mr. President. Move to be held under the rules.
Council Turiel moves it held under the rules.
sorry.
Further appointments and reappointments.
We have the mayor's reappointment of the following to the Cable, Television, and Technology Commission with the terms to expire March 10, 2022. William Simons, Kevin Walker, and Ollie Duverstein.
Council Turiel.
Thank you, Mr. President. I move for confirmation by roll call vote.
Council Turiel moves for confirmation by roll call vote. Under discussion.
Thank you, Mr. President. I'll just say that the work that this commission has done over the time that I've been on City Council, I've been the council appointee to it. That's the reason why we have a contract that's allowing competition to come in Salem, and they've been doing a great job of handling our relationship with our cable provider.
Thank you. Anyone else? Seeing none, Madam City Clerk, will you please call the roll?
Yep, Councilor Dibble?
Yes.
Councilor Dominguez?
Yes.
Councilor Flynn?
Yes.
Councilor Hapworth?
Yes.
Councilor Madore?
Yes.
Councilor Marcillo?
Yes.
Councilor Presnewski?
Yes.
Councilor Riccardi?
Yes.
Councilor Sargent?
Yes.
Councilor Turio?
Yes.
And Councilor McCarthy.
Yes. On the matter of the reappointments of William Simons, Kevin Walker, and Ollie Duverstein, can't believe I can say that, to the Cable TV and Access Technology Commission, 11 members of the voting, 11 in favor, none in the negative, matter carries. I just call them Ollie. Communications from the mayor.
We have a bond order for the sum of $1,565,000 to be appropriated to pay costs for replacing the boiler at Bentley Academy.
Council Turiel.
Thank you, Mr. President. I'm going to move for suspension of the rules, but before I do that, just this is not quite correctly described, as I discussed with the finance director, so I'll explain the rest on the floor here.
Okay. Council Turiel moves for suspension of the rules. Seeing no objection, Council Turiel.
Thank you, Mr. President. I'm going to move for adoption first passage by roll call vote. The explanation here is, this is, if you look at the documentation on this, The cost to Salem on this, the expected reimbursement in our documentation is that we will be getting approximately, the actual cost to the city is approximately $400,000. This is also, the rest of it is reimbursement from MBSA. But more to the point is this is not just a boiler replacement. We checked that with the finance director. This is actually rebuilding the heating system, the HVAC system for the school. So as part of things there, the boiler itself is end of life, but the entire system has to be replaced and rebuilt. That's why this number is a lot higher than you would see for just a simple boiler replacement, which maybe might be a few tens of thousands for this scale. This is a much larger project. It's just not described, not described the right way. So if there's any questions, I have a little bit of that information, but otherwise I would move for first pass for roll call vote. If there are any other things I would like to have that people would like to ask about, I would ask that I would amend that to refer it then to Administration and Finance co-posted if there's any further questions on it, because they would like to get this done in a reasonably time-sensitive fashion in order to be ready for the beginning of the subsequent school year, and it's a fairly involved project.
Thank you. Any further discussion? Councilor Dibble.
Thank you, Mr. President. I'd like to thank the good Ward 5 councilor for his suggestion here. I agree that there's a need to get this done and get it done in a timely fashion so that the work can happen over the summer. So I'd be in favor of taking first passage here tonight, putting it into a committee, asking and answering getting answers to a few questions that I have, maybe others might have questions, and then it would come back before us for our second vote. It does take 2 votes, but I'd like to be able to ask some questions, and I did not have a chance in the last 3 days to, with all the other things I've been working on, to ask the questions on this one here. As an example, there are quite a few schools outside of Salem that I'm aware of that are being proactive in terms of being carbon-free with proper design of their boilers and their HVAC, getting away from oil and getting away from gas. And that's something that we should be looking at here in Salem. This is a $1.5 million project, so I'm curious to see if we've taken steps to become carbon-free. As the City Council 2 or 3 years ago, we signed a document that pledges everything that we would take action on would be in the direction of being green, if you would. So I'm wondering if this is truly green. Thank you, Mr. President. So again, my suggestion is that we take first vote, first passage tonight, and we put it in committee at the same time, as the Ward 5 council just alluded to.
Any further discussion? Do you accept Council Dibble's?
Yeah, no, I accept that, no problem. And I would also say we want to invite from the school department, we want to invite their facilities manager, and presumably we will want to bring facilities from the city side as well.
I'll let you guys work out the details as we come. Any further discussion? Seeing none, Council Torio's motion for adoption for first passage and then refer back to the Committee on Administration and Finance, I'm assuming co-posted?
Yeah, co-posted.
Madam City Clerk, will you please call the roll?
Councilor Dibble?
Yes.
Councilor Dominguez?
Yes.
Councilor Flynn?
Yes.
Councilor Hapworth?
Yes.
Councilor Madore? Yes. Councilor Marcillo?
Yes.
Councilor Presnewski?
Yes.
Councilor Riccardi?
Yes.
Councilor Sargent?
Yes.
Councilor Torio?
Yes.
And Councilor McCarthy?
Yes. Thank you. On the matter of a bond order for $1,565,000 to replace the boiler in Bentley Academy and everything else they're doing over there. We have 11 members voting, 11 in the affirmative, none in the negative. The matter carries. Further communications from the mayor.
We have an order that the sum of $175,000 is hereby appropriated and transferred from the capital outlay to short-term DPS roof repair account to be expended by the engineering department to repair the main DPS facility roof due to extensive rain damage.
Councilor Terrio.
Thank you, Mr. President. I move for suspension of the rules.
Councilor Terrio moves for suspension of the rules. Seeing no objection, Councilor Terrio.
Thank you, Mr. President. I also move for adoption.
Councilor Terrio moves for adoption. Under discussion, Councilor Terrio.
Thank you, Mr. President. We are looking right now at longer-term options for our DPS facility, including moving it to another site and redeveloping that site. But in the meantime, that's some years off. The roof on that building has come to the end of its useful life and is leaking, and replacing replacing it is our best option for keeping that building functional for a few more years. So that's the way to go at this point, and longer term, that land will probably be redeveloped at some point.
Any further discussion? Seeing none, Council Terrell's motion for adoption. All those in favor? All those opposed? Motion carries. Further communications to the mayor.
We have an order in the sum of $49,510.67 be approved within the Retirement Stabilization Vacation Sick Leave Buyback Account to be expended for fiscal year 2020 contractual buybacks of two school department employees.
Council Terrell.
Thank you, Mr. President. I move for suspension of the rules.
Council Terrell moves for suspension of the rules. Seeing no objection, Council Terrell.
Thank you, Mr. President. I also move for adoption.
Council Terrell moves for adoption. Under discussion.
This is a contractual retirement buyback, and I wish Ms. Paddock-Spray and Mr. Cavallero a good retirement.
Thank you. Any further discussion? Seeing none. On Council Terrell's motion for adoption, all those in favor? All those opposed? Matter carries. Further communications from the mayor.
We have an order in the sum of $30,000 to be appropriated and transfer capital outlay to the short-term DPS salt shed study account to be expended for engineering services for a new fabric-type portable salt shed structure in accordance with the mayor.
Council Terrell.
Thank you, Mr. President. I move for suspension of the rules.
Council Terrell moves for suspension of the rules. Seeing no objection, Council Terrell.
Thank you, Mr. President. I also move for adoption.
Council Terrell moves for adoption. Under discussion.
This is to get the process going of getting us a new and the location and purchase of a new portable salt shed that we'll be able to move if necessary for our salt storage to help us with winter operations. Although, knock on wood, with a couple weeks to go, we haven't had much call for that this year.
You just jinxed the whole thing.
But I still remember I know I did. I apologize. I still remember 2015.
Thank you. I remember April Fool's Storm. Any further discussion? Seeing none, Council Terrell's motion for adoption. All those in favor? All those opposed? Further communications to the mayor.
We have an order in the sum of $2,500 is hereby transferred and appropriated from fund balance free cash to the general fund part-time salary to cover costs associated with providing social work as part of an internship program in accordance with the mayor.
Let the record reflect that Councilor Flynn has recused himself. Council Terrell.
Thank you, Mr. President. I move for adoption. I move for suspension of the rules.
Council Terrell moves for suspension of the rules. Seeing no objection, Council Terrell.
Thank you, Mr. President. I move for adoption.
Council Terrell moves for adoption. Under discussion.
Thank you, Mr. President. This is as it's put, that this is for reimbursement of an intern who will be helping us with our senior services.
Thank you. Any further discussion? Seeing none. On Council Terrell's motion for adoption, all those in favor? All those opposed? Mayor's informational page, none. Let the record reflect that Councilor Flynn has rejoined us. Motions, orders, and resolutions. Council Salem?
It's unfortunate.
Council McCarthy.
Thank you, Mr. President. City Council, March 12, 2020. Order that the City Council elect Councilor Masillo and Councilor Hapworth to the Affordable Housing Trust Fund Board of Trustees for Ordinance Chapter 2, Section 10002. The City Council shall annually elect two members of the City Council to serve for a term of 1 year. The City Council President or his or her designee shall serve for one term 1 year, and that their terms expire December 31st, 2020.
Under discussion.
Thank you, Mr. President. A couple of weeks ago, we asked anyone to reach out to me, and Councilor Masillo and Councilor Hapworth have agreed to step up. At this time, I am not sure whether or not I shall appoint someone or take on that role myself. I'll weigh that over the next couple of weeks before the next meeting, sooner than happen. But that being said, I want to thank the members that are currently serving, and with this order, we've also redid the dates on these. For some reason or other, the last time they were appointed, the date ran up to almost now, and it seems only right that the appointment should be annually as around December 31st as opposed to in the middle of April. Because you never know, it could be an election year, so they may not decide to run. It won't be on a board which they can't sit on because they're not member of the council. So it's just a matter of, the end part is just a matter of housekeeping, so. Thank you.
Thank you, Mr. President. Any further discussion? Being none. Council McCarthy. Move adoption.
Move that they be approved.
Council McCarthy moves adoption. All those in favor? All those opposed? The ayes have it. The matter carries. Thank you, Mr. President.
Thank you. Further motions, orders, and resolutions. Council Dibble.
Thank you, Mr. President. City of Salem and City Council ordered March 12th, 2020, that the Committee on Community and Economic Development, co-posted with Committee of the Whole, meet with Ability Triangle Incorporated for a presentation by this company.
Council Dibble.
And I move for adoption.
Council Dibble moves for adoption. Under discussion, Council Dibble.
Thank you, Mr. President. This is an amazing group, and the story of what they do should be told to the public of Salem and to the full council, the school department, the superintendent of schools, and others. I'm sure several people here in this room are aware of what they do. I had the privilege of taking a tour of the facility with Councilor Dominguez, and I'm not sure if anybody else came on that tour. But what we learned there, what we saw, and how they're helping so many people that have challenges, it's absolutely wonderful what's going on here in Salem. And for some of us, I had heard of Ability, not really sure what they did, but to take that tour, I was in awe of what they're doing and how many people they're helping. It's not just a few, it is dozens and dozens and dozens, and probably well over 100 people that have challenges. So I'd like to have a meeting of this, and just simply to educate the public and to see how the City of Salem can help them and how they can further help the residents of Salem. Thank you, Mr. President.
Thank you. Councilor Dominguez.
Thank you, Mr. President. I want to echo what the good Councilor Ward 7 just said, but I want to add a friendly amendment to his order, if I may, to invite also the superintendent, mayor office, and have the school committee also invited for that meeting, if you don't mind. Thank you.
Yes. I accept that.
Unfortunately, you can't invite the whole school committee. Because it's, you can pick and choose or invite maybe the head of buildings and grounds, but if you invite the whole school, it's a violation of open meeting law.
Yep.
So you only can, so I'll leave it to the discretion of the chair of whom he would invite, just to make sure he doesn't violate any of those rules from the school committee. So, just a caution on that. Any further discussion? Seeing none. On Council Dibble's motion that this be adopted, all those in favor? All those opposed? That carries. Council Madore. Further motions on resolutions. Council Madore.
Thank you, Mr. President. City of Salem and City Council, March 12, 2020, ordered that Section 36 of the Rules and Orders of the City Council be amended by deleting the reference to Cushing's Manual and inserting in place thereof Robert's Rules of Order. And I'm supposed to amend the name of that set of rules, but I forget what to. I'll call on one of my colleagues to help me out there. And I cannot make any motions until the next meeting. So.
No action can be taken under these rules until the next meeting on March 26, 2020. So moved. Further motions, orders, and resolutions. Councilor Dominguez.
Thank you, Mr. President. City of Salem, City Council, March 12, 2020, resolution. Whereas the young people of Salem, Massachusetts are tomorrow's leaders, and whereas many young people need professional youth services to help them achieve their full potential, and whereas the Boys and Girls Club of Salem, Massachusetts, serve more than 7 young people annually, and whereas Boys and Girls Clubs do whatever it takes to ensure every young person in America has the skill needed to graduate high school and be well prepared for life and work throughout programs like Power Hour, Diplomas to Degrees, Touch Class, and Keystone Club. Boys and Girls Club of Greater Salem helps youth to develop the soft skill and hard skill needed to close the job skill gap. Whereas Boys and Girls Club of Greater Salem will celebrate National Boys and Girls Club Week with some 4,000 clubs and over 2 million more children and teens nationwide. Now, therefore, we, the City Council for the City of Salem, do hereby proclaim March 30 to April 3rd, 2020 as Boys and Girls Club Week in Salem, Massachusetts. Furthermore, we encourage all citizens to join us in recognizing and commemorating our 150-year-old Boys and Girls Club of the Greater Salem for doing whatever it takes to be a greater future for the youth in our community. And I move for adoption.
Council Dominguez moves for adoption. Under discussion, Council Dominguez.
No, this is straightforward. We just wanted to quickly recognize the youth and make sure that we celebrate here in Salem. Thank you.
Excellent, thank you. Any further discussion?
No.
Council Sergeant.
Thank you, Mr. President. I just want to say a few words. Being this club coming forward from the beginnings of the old Salem Fraternity Boys Club that was founded in 1869 on Central Street in Salem is pretty unique. And it was a unique set of circumstances that started it. Because up until then, young boys, and it evolved to the Boys and Girls Club, but back then young boys could be a little bit of trouble in the downtown area.
No.
And so rather than taking them down to Winter Island and Plummer Home and maybe meting out some punishment in those days, there was some very forward-thinking businessmen in Salem, Mr. President. And what they did is they said, well, instead of going this way, let's take another direction. And let's give these young boys something to do. And that's what they did. And they raised money, got that club built or bought the building. Part of it used to be a bank, and we'd play basketball and run into where the old vault used to be when you were playing. But it was just a place to get kids off the street. So rather than looking at it as these kids were bad kids, they looked at it as these kids are good kids that just need something to do. And that started around the country here in Salem. That and Boys Town in Nebraska are probably the two most important things for young people in this country. So, and that was very forward thinking, and that was typical Salem to look at it a little bit different. And I really can't express enough some of those things. And it's a club that I went to from when I was 8 till I was probably 28, starting there as a young boy and then coaching kids later on and moving your way through. And they also did another forward-thinking thing. They raised money to keep the club going back then. There was an endowment, and the director would teach us about it, that they lived off the interest. When I was 12 years old, I knew how the club ran because the director explained it to us because, again, forward-thinking, they knew you wouldn't be young boys your whole life, that you would grow up and take a position of leadership eventually. So that's the kind of thinking they did. They lived off the interest on their endowment for many, many, many years, and then they got to be so busy that it got to be difficult to do that. So just want to get that out there. Thank you.
Provide a great service. Any further discussion? Seeing none, on Council Dominguez motion for adoption. All those in favor? All those opposed? That carries. Committee reports. Council Madore. Ooh, sorry. Council Dibble. Oh, did you have another motion?
Yes. Thank you, Mr. President. I wrote this up before we had a great presentation by our mayor and our health agent tonight, but I would still like to enter it in the chances that it's needed. So I'll enter it anyway. City of Salem and City Council, March 12, 2020, ordered that the Committee on Public Health, Safety, and the Environment, co-posted with Committee of the Whole, meet to discuss COVID-19 or the coronavirus, and I move for adoption.
Thank you. No discussion because it's late file, right? You brought it late or is it on the... Councilor Dibble's motion that the matter of the virus be referred to the Committee on Public Health, Safety, and Environment. All those in favor? All those opposed? Thank you. Committee reports. Councilor Madore.
Thank you, Mr. President. City of Salem City Council, March 12, 2020, the Committee on Ordinances, Licenses, and Legal Affairs, to whom was referred the matter of granting certain licenses, secondhand valuables, and tax days, has considered the matter and would recommend granted.
On acceptance to report, all those in favor, all those opposed. On adoption of the recommendation on discussion, Councilor Madore.
Thank you, Mr. President. No discussion.
The only thing I would add to this one is the fact that the girls' lacrosse is slated for 2 days from now, and I would leave that to the discretion of the school committee as to what their actions are with regards to their students. I mean, obviously, it may be an evolving situation, but I will leave the discretion of the school department on whether or not they allow that to happen. But just so for our records, we passed it, but it's up to them to whether or not they allow it. Their students. Is everyone cool with that? Good with that? Thank you. On adoption of the recommendation, all those in favor, all those opposed? Further committee reports, Councilor Terrell. No, Councilor Madore, sorry.
Thank you, Mr. President. City of Salem City Council, March 12, 2020. The Committee on Ordinances, License, Legal Affairs, to whom was referred the matter of a hearing request from Jose Fabian on the denial of his taxi operator license, has considered said matter and would recommend the license be reinstated with the following conditions: that the operator and officer overseeing the matter return to the City Council for review in the event the court finds Mr. Cornell convicted of a felony charge.
On acceptance of the report, all those in favor, all those opposed. On adoption of the recommendation, Councilor Madore.
Thank you, Mr. President. We met with Mr. Cornell and Officer Troncoso. Is it Troncoso? Troncoso, yes. And Mr. Cornell's daughter was present to interpret for Mr. Cornell. And we heard from both sides, from the police department and Mr. Cornell himself, and it turns out it was an unfortunate situation where we heard that there's some juveniles in the area who have been taking these taxi rides with vouchers that are invalid and then just taking off. And rather than reporting to the police, Mr. Cornell decided to literally take matters into his own hands and was holding down the juvenile customers until the police officers arrived. And as a result, he was arrested for assault. So the license denial was based on that charge of a felony charge because of the assault, but we felt that it was unreasonable, and Mr. Cornell had been out of a job for 2 months since the incident happened, so we decided to reinstate the license, and if the felony charge, if the court does find that he is convicted of the felony charge, that we would review the license again. So I think that was a fair decision, and I thank my committee for taking the time to hear both the testimony of Mr. Cornell and the officer.
Thank you. Any further discussion? Seeing none, on adoption of the recommendation, all those in favor? All those opposed? And it carries. Further committee reports.
City of Salem City Council, March 12, 2020. The Committee on Administration, Finance, co-posted Committee of the Whole, to whom is referred appropriation of $142,412.48 for repair for water main break on Bridge Street, has considered said matter and would recommend adoption.
On acceptance report, all those in favor, all those opposed. On adoption of the recommendation, Councilor Turrill.
Thank you, Mr. President. This is an ordinarily routine matter. It came up at the last meeting. I had a question related to the way it was accounted through a year end, because the service was done in late June, which is in the prior fiscal year, and the finance director appeared before the committee and explained to us that the reason for that was because it was out of a budget area that wasn't there. She had to wait until free cash was certified to be able to allocate it properly to that particular sewer account. So that was the reasoning behind it. There were a couple others incidents during the latter part of the year that were similar, where they were waiting on that, and it was dependent on the free cash certification to pay out of those accounts.
Thank you. Any further discussion? Seeing none on the recommendation for adoption, all those in favor? All those opposed? Matter carries. Communications from city officials, we did that one, we're into petitions. Petitions.
We have a request from the Salem YMCA to hold a road race, the Salem Road Race, in use of city streets on September 13th, 2020.
Council Terrell.
Thank you, Mr. President. I move to be granted.
Council Terry moves to be granted. On discussion?
No discussion. It's a long-standing customary race.
Thank you. Any further discussion? Seeing none on Council Terry's motion, this matter be granted. All those in favor? All those opposed? Further petitions.
We have a request from Salem YMCA to hold a road race, Which City 5K, in use of city streets on October 17th, 2020.
Council Terry.
Thank you, Mr. President. I also move this be granted.
Council Terry moves that this be granted. On discussion?
Thank you, Mr. President. Another one. This is one that's done around mid-October every year, and it's a nice race that, again, the Y puts this one on and raises money with it. Like the prior one, they're the beneficiary of these events, and I'll just note the one before that has become the largest race in Salem, the Salem Road Race. So, these are a couple of runs we like, and they run, and in the case of the Salem Road Race, it runs on a non-traditional route mostly, so they're good for the city and helps the Y raise funds, so.
Thank you. Any further discussion?
Win-win-win.
Any further discussion? Seeing none on Council Terrell's motion that it be granted. All those in favor? All those opposed? Further petitions.
We have the following license applications for public guides, taxi cab limos, and taxi operators.
Council Madore.
Thank you, Mr. President. I move that these be granted.
Council Madore moves to be granted. On discussion? Seeing none on Council Madore's motion that it be granted. All those in favor? All those opposed? Further petitions.
We have the following license application for a public guide.
Council Madore.
Thank you, Mr. President. I move that this one be denied.
Council Madore moves that it be denied. And under discussion?
Yes, thank you, Mr. President. I'm sure I got his name right. Mr. Valor, he came before the City Council last year to appeal the revocation of his license as a tour guide. We heard his case and also heard from Officer Jack Doyle on the reasoning for the denial. We decided to give him a second chance, and I guess he had to renew his license this year, and based on the behavior that he conducted himself since we reinstated his license, the officer decided to deny his license. And we have documentation showing his conduct as a public tour guide over the last 6-7 months. I think that we can share that with my colleagues if you wish to read them. I don't want to go into too much detail about this, and Mr. Valor has every right to appeal the denial as well, and he can pursue that path. But I would just like to say that as a public guide of the city, you are the face and you represent the city, and we expect a certain level of conduct professionally and personally, and Mr. Valor has not met that conduct, that expectation satisfactorily. So we feel that it's unfortunate that he has continued to conduct himself this way and wish that he would improve, but it's unfortunate we have to deny him this license at this time. We gave him a second chance. We don't know if we have the patience for a third or fourth or fifth chance. So happy to discuss more with anyone of my colleagues, but at this time, we feel that it's safer for the public and city staff and city officials to deny his license at this time. Thank you.
Thank you. Any further comment? Seeing none, Council Madore's motion that this matter be denied. All those in favor? All those opposed? It's denied. Further petitions.
We have the following license application for a taxi operator.
Council Madore.
Thank you, Mr. President. I move that this be denied.
Council Madore moves this be denied. Any discussion? Seeing none. Any further discussion? Seeing none. On the matter that this taxi operator is moved to be denied. All is in favor? All is opposed? Matter is denied. Further petitions.
We have a request for a hearing on a denial of a taxi operator license.
Council Madore.
Thank you, Mr. President. I move that this be referred to the Committee on Ordinances, Licenses, and Legal Affairs to hold an executive session if necessary.
Council Madore moves that this matter be referred to the Committee on License, Order, Legal Affairs to hold an executive session if necessary. Any further discussion? Seeing none. On Council Madore's motion, all those in favor? All those opposed? Further petitions.
We have the following drain layer contract operator license application.
Council Madore.
Thank you, Mr. President. I move for this to be granted.
Council Madore moves that this matter be granted. Any discussion? Seeing none. On Council Madore's motion, this matter be granted. All those in favor? All those opposed? Matter is granted. Further petitions.
We have 3 claims.
Council Madore.
Thank you, Mr. President. I move that these be referred to the Committee on Ordinances, Licenses, Legal Affairs.
Council Madore moves that these matters be referred to the Committee on License, Orders, and Legal Affairs. Seeing no discussion. All those in favor? All those opposed? Unfinished business.
We have a second passage of an ordinance to amend the traffic ordinance, handicap park on Hazel Street.
Council Torrio.
Thank you, Mr. President. I move for adoption for second and final passage.
Council Torrio moves for adoption for second and final passage. Any discussion?
No discussion.
Seeing none, on Council Torrio's motion for adoption for second and final passage, all those in favor? All those opposed? Further unfinished business.
We have a second passage of an ordinance to amend traffic stop sign at Wheatland and Lawrence Street.
Council Masillo.
Thank you, Mr. President. I move for adoption for second and final passage.
Council Masillo moves for adoption for second and final passage. Any discussion? Seeing none, on Council Masillo's motion for adoption for second and final passage, all those in favor? All those opposed? Further unfinished business.
We have a second passage of an ordinance traffic stop sign at Pingree and Lynch Street.
Council Torrio for me, thank you.
Thank you, Mr. President. I move for adoption for second and final passage.
Council Torrio moves for adoption for second and final passage. Notice any discussion? Nope. Seeing none. Any further discussion? Seeing none, on Council Torrio's motion for second and final passage, all those in favor? All those opposed? Anyone have any unfinished business or anything? Seeing none. Council Sergeant. Council Sergeant moves for adjournment. All those in favor? All those opposed? We stand adjourned. Thank you. Be safe out there, people.